Hi everyone, my name is Jack Frew and I'm a first year PhD student here at the University of Glasgow. Today I'm going to try and introduce my PhD project, which broadly investigates how we can transform rheumatoid arthritis from disease remission into cure. So broadly, rheumatoid arthritis is a chronic inflammatory disease where our own immune cells attack the joints, resulting in damage and at times total incapacitation of the joints. It's an incredibly prevalent autoimmune disease with around 1% of the UK population suffering from the condition. And in terms of its kind of pathology, if you have a look at the image in the top left-hand side here, we compare a healthy joint to a rheumatoid arthritis joint, where you can see increased redness and swelling alongside these targeted immune cells, which are reactive against their own proteins in the joint and drive lots of kind of self-destruction and bone damage. So with recent advances in treatment for rheumatoid arthritis, around 60% of patients can achieve remission from the disease, but this is not cure, and people still experience fatigue and pain, but also suffer recurring episodes of disease symptoms known as flares. So we currently believe that these flares are due to the failure of our other immune cells to delete these autoreactive cells. As such, my PhD focuses on how we can target and delete these autoimmune cells. So if you look at the middle section of my poster here, the diagram at the top of our screen shows another type of immune cell known as dendritic cells. And at the moment, these are the only known cell types that can delete these self-reactive T cells. So we've currently identified 5 subsets of these cells in the joints, and interestingly you can see that the A1 dendritic cells are increased in healthy joints, but A2 are increased in remission. So what I plan to do is facilitate an interaction between these A1 and A2 subsets with these autoreactive T cells as they're known, and we hope to then use computer models and genetic analysis to differentiate the interactions between healthy and rheumatoid arthritis dendritic cells to see mechanisms that we might be able to target. What we also want to do is work out why these different dendritic cell clusters occur, and we think one of the main cell types that might be involved in this are fibroblasts, which are lining layer cells of the joint. So what we want to do is effectively make a mini joint wherein we can culture remission or healthy fibroblasts with cells which make up your blood vessels and precursors from the peripheral blood for these cells. And we hope to identify, again, using computer models and genetic mechanisms, which whether the fibroblasts have an impact on whether A1, A2, or the other dendritic cell subsets you can see are produced. So thank you very much for listening to my presentation.